What is lymph? Can somebody tell what is lymph?
Tissue lymphatic vein.
So it is the interstitial fluid that drains into the lymph nodes. So lymph nodes, they are scattered all over the body and they vary in size from pinhead to large. They are bean-shaped structures and they are usually present in groups along the lymph vessels. So in normal adult body, there are up to 450 lymph nodes present. Okay. So if we see the structure, the cut section. So if we see the cut section of lymph node, it is an encapsulated structure. It has a capsule. This is the capsule. Then you have, these are the afferent lymphatics. What are afferent? What do you understand by afferent? What is afferent?
Sensory sensory that receive the stimulus.
Sensory afferent. So afferent term can be used for lymphatics, for vessels, and for nerves also. But what is the literal meaning of afferent? Literal meaning of afferent means the incoming vessels or the incoming nerves. If we say afferent nerves, it means incoming nerves. If we say afferent lymphatics, that means incoming, through which the lymph is flowing in the lymph node. Okay, afferent, incoming. Okay, and then usually a lymph node has several afferent lymphatics through which the lymph flows into the lymph node, and usually one efferent lymphatic. What is efferent? Now you can tell what is efferent. What is the meaning of efferent? Outgoing. Okay. So these are the incoming lymphatics or lymph vessels which enter the lymph node. So they can be more than one. Numerous afferent lymphatics and usually one efferent lymphatic which come out, through which the filtered lymph exit the lymph node. So this is the efferent vessel which emerges out through the hilum. This is the hilum, a small indentation in the lymph node through which the efferent lymphatic emerges out and the blood vessels, they enter through this hilum. This is the hilum of the lymph node. These are the vessels, the artery and the vein supplying the lymph node. And if you see the structure of a lymph node, it is divided into outer cortex and inner medulla. The cortex are having lymphatic follicles with a germinal center. Okay, this is the general structure of a lymph node. Then moving ahead, talking about axillary lymph nodes. So axillary lymph nodes, they are about 20 to 30 in number. Okay, and they drain lymph. They drain lymph from most of the upper limb and from superficial structures of thoracoabdominal region above the level of umbilicus and thymic crest, including the breast. Okay, so these axillary lymph nodes drain most of the upper limb and superficial structures, the skin and the superficial muscles of the thoracoabdominal region. Thoracoabdominal region, the superficial structures above the level of umbilicus. Okay, and so anteriorly the landmark is umbilicus and posteriorly the iliac crest. Above it, these superficial structures drain into the axillary lymph nodes, or the lymph from these structures enter the lymph nodes present in the axilla for filtration. Okay, they filter the lymph present in the lymphatics. Okay, and breast also, it is an important structure which is drained by axillary lymph nodes. It has very important clinical significance. Then, so these axillary lymph nodes are scattered throughout the axillary tract. Throughout the axilla, they are scattered and they transfer lymph towards the apex of the axilla. Now you must be knowing axilla is a pyramidal space. The pyramidal space having a base and an apex. So you can see the walls of the axilla. This is the anterior wall. This is the lateral wall, the medial wall, posterior wall, and this is the base. And this is the truncated apex. So these axillary lymph nodes, they are scattered in the fat, and the lymph is drained in the direction like they go from these lymph nodes present near the base of the axilla towards the apex. So lymph flows like this from the basal lymph nodes towards the lymph nodes present near the apex of the axilla. Okay. So we can see the axillary lymph nodes. For description, they are divided into 5 groups. Okay, we describe these axillary lymph nodes by studying them in groups. They are present in groups. So one is the anterior group. This is the anterior group, also called pectoral group. Okay, anterior or pectoral group of lymph nodes. Then this is the lateral group. Lateral, also called the humeral. They are in relation to the humerus, also called humeral lymph nodes. Then the posterior, these are the posterior group, also called the subscapular lymph nodes. Posterior or subscapular group. Then you have the central group. This is the central group, and lymph from all these flow towards the apical. This is the apical group of lymph nodes. Okay. Then coming to the anterior or pectoral group of lymph nodes. So they are present in the antero-inferior angle of axilla. This is the antero-inferior angle of axilla, and they lie deep to the pectoralis major muscle. This muscle is pectoralis major. So deep to this, they are present. These are the pectoral group of lymph nodes, or the anterior axillary lymph nodes, and they lie along the lateral pectoral vessels, the lateral pectoral vein. Okay, you can see this is the pectoralis major muscle, which forms the anterior axillary fold. And if you see, this is the anterior axillary fold. Which is this muscle? Can anybody tell this muscle? Which muscle is this?
Anterior.
Yes, this is serratus anterior. Yes, this is serratus anterior. And this is the part of breast, the fat present in the breast. Okay. So the afferents means the lymphatics which are entering, or draining some structures and entering into the anterior group. So the afferents, they come from the anterolateral abdominal wall, anterior and the lateral thoracic and abdominal wall above the pelvis and from the breast. So these structures, the lymph from these structures enter the anterior or the pectoral group of lymph nodes. And the efferents means the vessels, the lymphatic vessels which are exiting. These pass to the central group of lymph nodes or to the apical, partly to central and partly to apicals. Okay, afferents come from these structures to the anterior group, and efferents, they pass partly to the central group and partly to the apical group of axillary lymph nodes. Okay, so these are anterior pectoral group. Then the lateral or humeral group, they lie along the axillary vessels, and they drain the greater part of most of the upper limb. The lymph from most of the upper limb enters this lateral or the humeral group of lymph nodes. Then the posterior or the subscapular. Okay, subscapular or the posterior group, where they present, they lie on the inferior margin of posterior axillary wall. Posterior axillary wall, inferior margin. If you see this diagram, the posterior group, these are the posterior group, the inferior margin of the posterior wall. If you see, this is the posterior wall, and in the inferior margin, they are present and they lie along which vessels? So usually lymph nodes are present along some veins or vessels. They accompany the lymphatic vessels. They accompany the blood vessels. Whenever they are running along with the blood vessels of that region. So these lymphatics and these group of lymph nodes, the subscapular group, they lie along the subscapular vessels. The subscapular veins and arteries, they lie along these vessels. And from where they drain lymph from the corresponding region of the back region, corresponding back region above the level of breast. The back region is drained by these subscapular group of lymph nodes. Then the central group. So in the central group, there are about 3 to 4 lymph nodes and they lie embedded in the axillary flat. So if you see in the diagram, this is the central group. The central group of lymph nodes, 3 to 4 in number. Comparatively, they are larger. The central group comparatively larger, and they drain lymph from these group of lymph nodes, the anterior, posterior, and the lateral group. The efferents from these form the afferents of the central group. Okay. And so, as we have told, the afferents of the central group come from all the preceding groups: the lateral, the anterior, and the posterior axillary lymph nodes, and the efferents, that is the lymphatics which are coming out of the central group, they go to the apical. As we have told, the lymph nodes from the basal lymph nodes towards the apical group of lymph nodes. So, talking about the apical group, this apical group consists of about 6 to 12 nodes and they extend to the apex of axilla, medial to the axillary vein. They lie medial to the axillary vein and they drain all other lymph nodes. All other axillary groups of lymph nodes eventually drain into the apical group. And apart from the other axillary nodes, they also receive afferents from nodes on the cephalic vein. Have you heard about cephalic vein? So cephalic vein is a, who will tell?
Ma'am, tributary which enters into subclavian.
It is a superficial vein of upper limb. Okay, superficial vein of upper limb. Along this vein, also some nodes are present, and those nodes also drain in the apical group as well as in the infraclavicular fossa. Nodes in the infraclavicular. Infra means below, clavicle. Below clavicle, the fossa. In that fossa, there are also some lymph nodes that also form the afferents to the apical group. Okay, apart from other axillary nodes, the nodes on the cephalic vein and in the infraclavicular fossa. And the efferents from the apical group, they form a subclavian lymphatic trunk. Okay, all the efferents, they form one lymphatic trunk which is called subclavian lymphatic trunk, and that usually drains into the subclavian vein. So what happens that the lymphatics, they eventually drain into some vein. Okay, the lymph eventually, after getting filtered by the lymph nodes, finally drains or get flowed into the vein. So this subclavian lymphatic trunk drains usually into the subclavian vein. So now see in this figure, this is which vein? Name this vein. And these group of lymph nodes are, tell, these group of lymph nodes are which group? This group is
Pectoral group.
the pectoral or the anterior group, which is lying along which vein? This vein is, or these vessels are lateral pectoral. Lateral pectoral vein. So these pectoral group of lymph nodes, they are lying along the lateral pectoral vein. Now these group, which is this group, subscapular group which lies along which vessels? They lie along subscapular vessels. And now see this group, this one node is visible. This group forms the
Lateral or humeral.
lateral or humeral line medial to the axillary vein. This is the axillary vein. Medial to it lies the lateral axillary nodes. Now this node, this one node which is visible is from which group?
Central.
This is the central group of lymph node. From we can see the vessels from these lower groups, they are running towards the central group. Then these group of lymph nodes are these are the apical group of lymph nodes. Lymph from all these other groups flow eventually to the apical group of lymph nodes. Now you can see the direction of the flow. So these pectoral group of lymph nodes, they drain lymph from the anterolateral thoraco-abdominal wall above the level of umbilicus, including the breast. Okay, and these posterior group drain from the corresponding region of the back above the level of iliac crest. These lateral group, they drain from most of the upper limb, and from these three groups, they flow to the central group and eventually to the apical. Some lymphatics, there is no rule. Some lymphatics may skip the central and directly go to the apical. Okay. So some lymphatics may directly go to apical. Some lymphatics from these groups flow first to the central and from central to the apical group of lymph nodes. Okay. This vein, are you able to see? This vein is which vein? This vein is
cephalic.
This is the cephalic vein. Okay, so these cephalic veins, the lymph nodes along these cephalic veins may also drain into the apical group of lymph nodes. Okay, this is which muscle? This muscle is
Deltoid.
deltoid. This muscle?
Serratus anterior.
Pectoralis
minor.
Pectoralis minor. Okay, pectoralis minor. So you can see these pectoral lymph nodes, they are lying along the lower margin of pectoralis minor. They're deep to pectoralis major. Just deep to inferior part of pectoralis major and along the lower margin of pectoralis minor muscle. Okay. So these are the groups of lymph nodes. If we talk about the clinical importance, they are very, very important clinical. The axillary group of lymph nodes, what is lymph node enlargement? If the lymph nodes enlarge from their normal size and become palpable. So usually, if you palpate these groups of lymph nodes, they are usually not palpable in the normal person. But when they are enlarged, they become palpable. You can palpate them and you can feel them to be enlarged. Okay. So what is lymphadenitis? What is lymphadenitis? What do you understand by lymphadenitis? Can anybody tell?
Inflammation of lymph node.
Inflammation of lymph node. So lymph eddy stands for gland. Lymph eddy and lymph node. Itis is for inflammation. So lymphadenitis means inflammation of lymph nodes. So these axillary lymph nodes may get inflamed in certain conditions. Okay. Then what is metastatic spread? What is metastasis? What is metastasis?
Lodging of cancerous cells from primary part to skin.
Okay. Metastasis is when cancerous cells, they move to distant sites from their original site. So most commonly the breast cancer spreads through the lymphatics. So lymphatics which are draining the breast, they they become the channels through which the cancerous cells of the breast or the malignant cells in the breast, they reach these lymph nodes through the lymphatics. Through the lymphatics, the malignant cells of the breast reach the lymph nodes, and this is called the metastatic spread. And these lymph nodes, now in those lymph nodes, the metastasis and these malignant cells start dividing and they become enlarged. These lymph nodes become enlarged in case of breast carcinoma if there is spread through the lymphatics occurs. Okay. So in that case, the palpation of the axillary lymph nodes becomes very important in case of breast carcinoma. It gives us idea whether the cancer has spread or not. Okay, it gives a clinical idea if we are able to palpate these axillary group of lymph nodes in case of breast carcinoma. It gives an indication that these lymph nodes may have got involved with the malignant condition. Okay. So there is one term called sentinel node. What is sentinel node? So sentinel node we define as the first node to get involved with metastasis. Okay, the first node that gets involved with the metastasis is called the sentinel node. So usually surgeons do biopsy of the sentinel node, okay, to see the condition whether the malignancy has spread or not. Okay, what is axillary lymph node dissection? Axillary lymph node dissection. So in case of breast carcinoma, if these axillary lymph nodes get involved or get filled with malignant cells, then the surgeon needs to dissect out those involved lymph nodes. Okay, as a part of management of the breast carcinoma. To completely eradicate the carcinoma, these axillary lymph nodes also need to be dissected out. So this is called axillary lymph node dissection. Then what is lymphedema?
Accumulation of the lymph in the tissues.
Lymphedema means when the lymphatics are not working properly. The lymph is not flowing through its natural route. The lymph gets accumulated in a interstitial space and there is swelling of that affected area. So usually happens lymphedema of the upper limb. When the axillary lymph nodes are getting dissected out, the lymph starts collecting in the upper limb. Okay, so the lymphatics, the lymph is not able to properly channel or properly drain and causing the lymphedema of the upper limb post surgery in case of breast carcinoma patients. Okay, so we have anything you want to ask up till now?
Yes, ma'am. Ma'am, please repeat sentinel node.
Okay, sentinel node, even if you are not able to understand it properly at this level, it's okay. Sentinel node you will study ahead or afterwards in more detail in surgery. So sentinel node is the first node to get involved in metastasis. Okay, in breast carcinoma, the metastatic cells or the malignant cells go through the lymphatics. So the first lymph node to get involved. Okay, if one node gets involved, eventually from that lymphatics through the lymphatics, it may reach to other nodes also. So the first node to get involved, or the first node which comes across, if that gets involved, then there is much suspicion, and the surgeon has to decide whether to dissect all the axillary nodes or not. And if the sentinel node or the first node draining is not involved, then he can think about that the metastasis has not yet occurred. Okay, if the first node is not involved, we can say that the other nodes will also be not involved. Okay, is it clear?
Yes, ma'am.
Okay. So then moving ahead, there is also a small topic, the intermuscular spaces. So see this diagram. This is showing the scapular region, and you can see several muscles, they are originating and inserting, and they are forming some spaces. Some spaces are being formed in between the muscles. So these are the intermuscular spaces present in the scapular region. So let us define these spaces, the boundaries and the structures which are crossing, which are passing through the spaces. Can you see the space? The space which is formed. So this is called upper triangular space. This is triangular. You can see this is a triangle, upper triangular space. Okay. Then see this space and this space. This is called lower triangular space. Okay. Upper triangular space and a lower triangular space. And see this space, another space. This is somewhat quadrangular, huh? So this is called the quadrangular space. And so we can see three spaces here, three intermuscular spaces which are formed, and these are the upper triangular space, this is the lower triangular space, and this is the quadrangular space. So what are the boundaries? What muscles are forming boundaries? First see this. Okay. So this is which muscle? Name this muscle.
Teres minor.
This is teres minor. So you can see this is forming the superior boundary. Superior and lateral, superior and medially. Somewhat superior and medially. So superiorly, this is formed by teres minor muscle. Then inferiorly, what is present? This muscle is teres major, and laterally we have, this is the long head of triceps. Long head of triceps, yes. So triceps is having three heads, and this is the long head of triceps, which form the lateral boundary of the upper triangular space. Okay. Superiorly we have teres minor. Posteriorly, this is the posterior view. Okay. If we see from the anterior aspect, which muscle will be lying superiorly, or which muscle will be forming the superior boundary of this triangular space? Can you tell? Which muscle will be lying here? Anterior aspect. So anteriorly we see. This is the posterior view. Posteriorly we are seeing this teres minor muscle. From anteriorly, subscapularis. Yes, subscapularis. What? Subscapularis will be forming anterior, from the anterior aspect, the superior boundary of this upper triangular space. Laterally we have the long head of triceps, inferiorly the teres major muscle. Okay. And now see what structure is passing through the space. Through this upper triangular space, what are these vessels? These vessels which are passing through the upper triangular space are the circumflex scapular vessels, the circumflex scapular artery and vein. Okay. Here only the artery is shown, vein is also accompanying, and they pass through this upper triangular space. Okay. Circumflex scapular vessels. So this is upper triangular space. Now look at this lower triangular space. Okay. This is the lower triangular space. Now what is forming the superior boundary? Which muscle?
Teres major.
Teres major muscle is forming the superior boundary. What is forming the medial wall or medial boundary of this lower triangular space? This is long head of triceps. Yes, long head of triceps is forming the medial wall or medial boundary, and the lateral boundary. What is forming the lateral boundary of this lower triangular space? This is the border of humerus. This is the shaft of humerus. The shaft of humerus is forming the lateral boundary. Yes. Now see what is passing through the space. This space, this lower triangular space. What is passing? This one nerve is passing and some vessels. Okay, blood vessels and nerve. So this is which nerve? Which nerve? Which is passing, which is coming from the anterior aspect, passing through this space and entering the posterior compartment of the arm. This nerve is radial nerve. Okay, radial nerve passes through this lower triangular space coming from the anterior aspect, passing through the space, entering the posterior compartment of arm. Okay, running in the roof, which is called radial roof over the humerus. Okay, so this is radial now. Now see which vessel, which artery and veins they are passing. So the artery is the profunda brachii artery, profunda brachii artery and the profunda brachii vein. Okay, what do you understand by profunda?
Deep.
Deep. Okay, deep branch. Brachii refers to okay. Okay, so deep or deep. So this is a vessel which is running deeply in the arm. Okay, so hence the name profunda brachii artery. Along with the vein, vein is not shown. Vein will also accompany. So these are the structures, the radial nerve, profunda brachii vessels which are passing through the lower triangular space. Okay, upper triangular space, lower triangular space. Now see this quadrangular space. What is forming the boundary? Superiorly, what is this? Superiorly, this muscle is minor muscle. Okay, teres minor, and anteriorly subscapularis. Okay, so they form the superior along with the shoulder joint capsule. Okay, in between there will be shoulder joint capsule of the shoulder joint, which also forms the superior boundary of this quadrangular space. Okay, then what is medially? Medially we have
long head of
triceps, and inferiorly
teres
major muscle, and laterally we have the
lateral of lateral part humerus.
Which part of humerus? So this is the surgical neck. This is the surgical neck of humerus. Here is the surgical neck. This is called surgical neck. What happened? Okay, it is visible now.
Yes, ma'am.
Okay, so literally this is the surgical neck of humerus, and see what is passing. What is passing through this quadrangular space? Which nerve? This is one nerve is passing and blood vessels are passing. So this nerve is axillary nerve. Okay, axillary nerve passing through the quadrangular space, and the vessels these vessels are posterior, circumflex, humeral, artery and vein. Posterior, circumflex. Circumflex means, so posterior means they are coming from posteriorly, they are running posteriorly. Circumflex means they are taking a turn. They are encircling the surgical neck of humerus, posterior, circumflex, humeral, artery and the vein. Okay, so these are the structures which are passing through the quadrangular space. Which nerve is passing? Axillary nerve, and the vessels are
Posterior circumflex.
circumflex, humeral, artery and vein. Okay, is it clear? All the spaces and the structures and structures. So these spaces are created because of the muscles running in different directions. So these spaces are created through which the structures are passing. So we see the quadrangular space. The superior boundary is formed by the subscapularis, the capsule of the shoulder joint, and teres minor muscle. Medially, the long head of triceps, inferiorly teres major, and laterally the surgical neck of humerus. The structures passing are axillary nerve, posterior circumflex, humeral, artery and vein. And the upper triangular space, the superiorly subscapularis, teres minor, subscapularis anteriorly, posteriorly teres minor, inferiorly teres major, laterally the long head of triceps. Structure passing to the upper triangular space of circumflex scapular muscles, and in the lower triangular space, if we see, superiorly formed by the teres major, the boundaries, the medially long head of triceps, laterally shaft of humerus. Okay, the structures passing are radial nerve and profunda brachialis. Is it clear? The spaces.
Yes, ma'am.
Okay. So, if you have any queries, you may ask till now. This is all about today's class. If you have any query, anything you want to ask. So axillary lymph nodes are very important clinically. Okay, they become palpable and clinically they are palpated in several conditions. In breast carcinoma, it becomes very important to palpate these axillary lymph nodes to see whether they are palpable or not.
Ma'am, please repeat the name of the axillary lymph nodes.
Name. Okay, the groups.
Yes, ma'am.
So these are the groups: the anterior or the pectoral group, the lateral or the humeral group, the posterior or the subscapular group, and the central group, and the apical group. These lymph node groups are present in the axilla. Okay.
Okay, ma'am. Thank you, ma'am.
Anything else?
Ma'am, histology of lymph gland.
Lymph node, the structure, if you see. So if we cut the lymph node and if we take a section, we section it, so you can see in a lymph node there is a capsule, fibrous capsule, and you have, this is the hilum. So these are bean-shaped structures. Lymph nodes are bean-shaped structures having a hilum, and this is the capsule. These are the afferent lymphatics, the lymphatics through which the lymph is entering the lymph node. Lymph is entering the lymph node. Then, if you see, these lymph nodes are divided into outer cortex and inner central medulla. Here, you will see some lymphoid follicles, okay, having a germinal center. This is the efferent lymphatic vessels, and these are the arteries and veins supplying the lymph node. Okay. So the capsule, it sends some septations inside. These are called trabeculae. These are the trabeculae which are arising from the capsule. It enters the capsule, sends some septations inside the substance of the lymph node. These are called trabeculae. Okay. Okay.
Yes, ma'am.
So this is all for today. If you have queries still, you may ask, or should we end? Okay.
Hello.
Yes.
Apart
Yes.
from this lecture में anastomosis के बारे में समझा दें मैम थोड़ा. Anastomosis किस कहते हैं मैम?
Anastomosis. Okay. So anastomosis, what does it mean? Anybody? Anastomosis means when two vessels, they connect. They form a connection. One vessel is running, another vessel is running. They form connection. So anastomosis means connection between two vessels. Okay.
डायरेक्ट कनेक्शन होता है या स्पेस होता है उन दोनों के बीच में?
नहीं, a vessel is connecting. A vessel is connecting two vessels. If I like two vessels, one vessel is running, it is supplying one area. Okay, another vessel is coming from different area, and when they meet and they form a channel, communication between two vessels or two arteries. Usually, for arteries we use anastomosis. Okay, so when they form connection, this is called anastomosis. And what is the importance? What is the importance of these anastomosis? The importance is
One of them block, then other will supply.
so if one vessel gets blocked or is unable to supply, then these anastomotic channels, they help in supplying, because if one vessel is supplying whole this area, how to tell? If one vessel is okay. If you see, you go and see in your books. So if one vessel is coming, it's originating from one vessel, and the other vessel is originating from a different artery. So if the main artery of this vessel gets blocked, the blood supply will be compromised. So these anastomotic channels help to retrieve the blood supply of that particular area where the artery gets blocked. Is it clear to some extent?
Yes, ma'am. Thank you.
Okay, if we get time next class, I'll show you some figure. Okay. Okay.
Yes, ma'am.
Okay. Anything else? Okay. Should we end? Okay. This is all
Yes,
for
ma'am.
today's class. Okay.